Thank you very much, Dr. Gomez. Thank you. And let me see if there are some questions. But before the questions, I would like to give the gift for everyone in this room today. Everybody from Saudi Arabia or Dubai or anywhere in the world, if he is interested to join the advanced aesthetic program, which Dr. German Gomez is the director of this program in Dubai. It will start, I think, in when?
In Dubai in September.
In Dubai, starting in September, and in Khobar in Saudi Arabia will start in August. Right?
Yes.
In August. So whoever joined this webinar today and he wants to join the aesthetic program in Khobar in Saudi Arabia or in Dubai, he will get a very, very, very special deal from Mastery Academy. All what you need to do is go to the link and put your name in the link. Now in the chat box, there is a link. You can check in the chat box. There is a link and you can just write that you are interested. Just fill the form. There is a form. And then we will call you back and we'll give you the gift from Mastery Academy for this program.
The link is in the chat section. You find the link in the chat section.
I didn't get the link. The link in the chat,
Yes.
You just go to the chat and you will find the link. Just fill the form. There is nothing mandatory. If you fill the form that you are, doesn't mean that you have to pay something or you have to register. It's just you are interested. Then we will call you back. Okay? Thank you very much again. I will go now to questions and answers.
So again, don't be afraid. It's not that you register with this registration. It's only that you are interested in joining me and the other great doctors in either Saudi Arabia or in Dubai.
Yes, maybe you know in Dubai there is Dr. Anas Al-Aoum. He is very, very well known. And Mr. Muhammad Abdul Jawad, in the expert, very much expert in dental photography, professional. And in Saudi Arabia, there is Dr. Omar Shihabuddin, Dr. Joe Sabbagh from Lebanon and Belgium, from Belgica, and Mr. Muhammad as well. So now, if you are interested, don't write interested. Please fill the form. If you don't fill the form, we don't know that you are interested, okay? Okay. We do get the certificate. Yes, you will get a certificate for this webinar. You will receive it in your email. Okay. Hope to come to Riyadh soon. We are coming to Riyadh, but for sure, Khobar starting in August. Okay. Now the questions. What is the satisfaction of patient by new smile? Also, what most difficult to do in smile design for males or female?
Okay, these are two questions in one. The satisfaction of the patient depends always on your communication with the patient. Okay, you have to find out what the patient wants before you start to design. Okay, and of course you can include the patient in your design process by, for example, if you have already the wax up, doing a mock-up of this wax up in the mouth of the patient with acrylic, for example, and then the patient already sees how he could look later with the final veneers. Or you have a software where you can do that also. Okay, so that's the first thing. The second thing is to lower a little bit the expectations of the patient. The patient who is ugly with a nice smile still is ugly, but ugly with a nice smile. A nice smile can make a patient a little bit more attractive, but what they think is if they have this kind of face, okay, but this beautiful smile, that they will be attractive for the other people, okay, and this is not going to happen. So their satisfaction is going down. So you can lower the satisfaction and say, hey, you will get a beautiful smile, and you can show that smile with confidence. And believe me or not, confidence in a person lightens up this person, lightens up the eyes, lightens up everything. Okay, so satisfaction can be guided by you, can be controlled by you, and this is only with your skills of communication you can really make a patient satisfied or not satisfied. It's your communication, and of course your fingers later if you have trained with the Mastery Academy course. And this, the second thing, male, female, okay. Also, I said the design of male teeth is more squarey and more triangle teeth. You can try it out also in wax ups or in softwares, okay, for the patient, and then as a mock-up in his mouth, and then the patient can say, I don't like this, and he guides you a little bit. You change that, and then another mock-up, and then the patient says, no, now it's good, okay, and you take that new wax up as the basis for the final veneers, of course. And this is also getting into the course that I teach. You need from this wax up to make your prep guide. So you prep exactly so that everybody can get, the dental technician has enough space to make the veneers. But this is another topic for the course.
Yes, and now there is a question. Is Dr. Herman doing the composite module? Yes, of course.
Yes, I'm doing the veneer module, the composite module, and in Dubai also the red aesthetics and crown lengthening and biological width and laser module.
And believe me, I never seen a composite lecture like Dr. Herman Gomez lectures. You know why? This is the secret, that Dr. Herman, in few years ago, he was the director of Vivadent Ivoclar. And you know who is Vivadent Ivoclar? So he knows things from inside the kitchen, from the kitchen. He see how the composite is made from the kitchen. So the best person to teach you composite is Dr. Herman. Now, other one, please visit Jeddah. Yes, we promise that we will visit Jeddah, but also you can get a special price and come to Khubar. He is a great doctor. Thank you.
Oh, thank you so much.
Now, the communication with lab technician. One person is asking, how can I communicate with the lab technician? He will answer, but also in the module of dental photography, you will learn a lot of secrets how to communicate with lab technicians, because dental photography is one of the most important communication tools. And Mr. Muhammad, who teach you, is the dental technician, and he is the director of a very important dental laboratory in Bahrain, which is GPS. Please go ahead.
Yeah, the photography is one of the key factors. Okay, so share these pictures from the before, from inside, everything, the colors. Share also, and this is a small gift to you. Share also the color of the stumps once you have made the prep. So what color do the stumps have? The prepped teeth, what color does the prep tooth has? Okay, the dental technician needs to know what color do you want at the end as an end color. Then what color does the prep tooth right now have? So he can say, okay, with this thickness of veneer, I need to have a much lighter color to get to the final result, because this plus this do the final result of the color of the veneers. Okay, so the dental technician needs to have most of the information. Also, There are some books where that you can share with the dental technician, where there are some smiles, like if you go to a hairdresser and he has different hairdressing styles, okay? So there are different smile styles, okay, with longer teeth, with shorter teeth, with wider teeth, with more squarey, more oval, more pointed teeth, okay? And every style has a name, usually a number 15, number 122. And then if you go with these styles that you think is the best for the patient, or even you discussed with the patient, okay, and both of you, patient and you, are okay with that style is good for the patient, then you tell the dental technician, hey, listen, make the wax up exactly in that style, so that we have exactly the possibility to do the veneers like we want them to have. So or you make pictures of your mock-up. You do a mock-up with composite. You do like the veneers should be with composite in the mouth, and make a picture of that, make an impression of that, okay? So that the dental technician knows what you want, and what you and tell the dental technician, I want to fill up the buccal corridor a little bit, please do that. Everything has to be registered. The more information the dental technician gets, the better the outcome.
Yes, and this is another gift from Mastery Academy, that everybody registered in the program, he will get a Smile Guide book. Smile
Yes.
Guide book we will send to all students in the program, in the Advanced Aesthetic program in Dubai or in Khubar.
I have no idea where they have it from.
Okay. You say, is it free? What do you mean? Do you mean the aesthetic program? No, promise me. If you don't give, you don't get. If you don't give, this is everything in life. If you don't give, you don't get. Yes, you can get something free, like this webinar, but you cannot in this life. This life taught me that if you don't give, you don't get. You have to give something. The gift is that we will give you a better discount, a special discount, but nothing is for free. And the same answer for the Smile Design softwares. Somebody asking if the Smile Design softwares are free. There are some.
Yeah, some of them, yes.
But the free is not good. If you want good thing, you have to pay, Habibi. No pain, no gain. And payment is painful, I know. But the benefit that you will get from the course or from the software is much, much, much higher than the investment that you will put in this education. And do you think no prep veneers are hygienic or for the patient?
Okay. In no prep veneers, to make them hygienic, I know where this question is going to. If you make no prep veneers, of course, you have something on a tooth that is not prepped, so you have a step. Usually near the gingiva or inside the gingiva, you have a step. And a step is always bad, because bacteria will get stuck there, food will get stuck there. So the secret, should I say it or should I leave it for the course? I say it. I'm very generous today. The secret is to take that step away. Once you have cemented the no prep veneer, you go in with special burrs, and you take that step away. So you transform a not hygienic no prep veneer into a hygienic no prep veneer.
Bravo, thank you. Is there a certificate for the webinar? Yes, and you will receive it in the email. And there is the record also, which is very, very valuable. You will get a replay of this webinar. And you are so amazing, doctor. Thank you. And is there hands-on patients in the aesthetic program? No, you will be having hands-on the models, but step by step. The doctors will hold your hand and you will work on very good models, and you will learn the techniques on that models. When the patient have lip deformities, we cannot use the lip for the horizontal line. Do we depend on the interparallel line?
Well, we might depend on that line. We also look.
مدام سكري مدام سكري ايوه okay.
We also could in our mind make a vertical line of the face and think of a horizontal line to that vertical line. Okay, so because our smile has to be according to the face, so it's not according to the eyes. As you see, my eyes are not on the same level. Okay, it has to be according to the face, So when I smile, usually my upper lip line is horizontal. Okay, if that is not okay, because I cannot rely on that, I look at the eyes. If the eyes are not in the same level, then I mentally make a line, a vertical line of the face, and I make a horizontal line to that one. I make a picture of the patient and do it on the picture. Okay, and I draw it on the picture.
Thank you. How we will get the certificates? By email, and you will get also the record again. And thank you very much for this valuable webinar. Thank you very much. And how will we see you in Riyadh? Yes, inshallah. But also Riyadh is close to Khubar and Dubai. You can come and get the discount now. So happy for Dubai. How will we know if the buccal corridor should be filled with veneers, or if it has or we have to make ortho?
Ortho? Oh no. Hey, the first option is always ortho. Okay, so the smile is not even. The smile is not good. First option, always ortho. Why? Because also, if after ortho the smile is not beautiful, at least you have put the teeth in a better position to have a better outcome with less taking away from the teeth. Okay, or less adding to the teeth. If you have to add a lot, that veneer is not stable. Okay, so you have to first put the teeth out and then add. Okay, so ortho is always the first option. If the patient does not want ortho, no, I don't, then you have nothing else to do than veneers, of course. And the buccal corridor, you smile, it's not filled, you need to fill it.
Yes, I have one. My friend is orthodontist near to me, and he was very happy with this answer. Okay, thank you. Is there any other webinars? Yes, after 1 month, inshallah, there will be another webinar for dental photography. And the next question, does the shape of the face have a rule in shape of the tooth selection? Rounded edge, sharp edge, something?
Well, this was many years ago a topic. Nowadays, it's less important, but rounded faces, squarey teeth, do they match? Okay, that is mostly the question. They still match if you don't make them too squarey. Okay, but too rounded for rounded faces is making it perpetual, and that is also not beautiful. Okay, it's better if we try out things with the patient and put a little bit of composite here, a little bit of composite there, and try to see with the patient how it will look. But there is not a rule that rounded surface has rounded teeth.
No. Yes. Is the dental photography webinar for free? Yes, it is for free. But those who are looking only for free things, believe me, this is not the right way to succeed in your life. And what age do you recommend patients to undergo these procedures?
Okay. For veneers, I would I put in my patients, I put 18 years as a minimum age, and only if they are patients that have some problems. That means, first problem, they have like very small lateral teeth, extremely small lateral teeth, okay? And they, of course, want to have a beautiful smile with that. With 18 years in women, 21 years in men, we have had all the growth of everything. That means the gums, the bones, everything has grown, okay? So in women, 18 years, we can do the veneers on the lateral teeth, okay? If everything is all right, I would not touch the rest, okay? Now, if the teeth are extremely unpleasant, or the patient has amelogenesis imperfecta, for example, okay, really big issues, then we also do all the teeth if the patient wants, with 18 or with 21. Before that age, composite.
So how I know your new programs? Just fill the form in the link. Can you, Mr. Yassin, put the link again? If you are interested in Khubar program or in Dubai program or any other program, just fill the form and our educational advisors, they will call you back soon. Thank you very much. And the last question, some patients need their central incisor as rapid design. How do we know if it suits them or not?
It's a rapid design. How do we know if it suits them? Okay.
Yes.
By doing a mock-up. Either we do a mock-up in the mouth by ourselves with the composite, or we tell the dental technician to do a wax-up. Then we make an impression of that wax-up. We fill it up with acrylic. We put it in the mouth of the patient. We take it out and see with the acrylic how it looks. So that's how we know if it suits.
Okay, how do I know the price for hands-on? Please fill the form and our medical advisor will call you and he will give you all the details. But I will tell you now, I will tell you the secrets. The gift. The program in Khubar is 4 modules and the normal price is 22,000 Saudi riyals, installments for 5 installments. But if you attend this webinar and fill the form and you decide in 3 days, you will get it for 18,000 only and 5 payments. In Dubai, it is 5 courses. So it is 28,000 dirham. And after your gift and your special price will be 24,000 dirham. And it is installment for 5 times, 5 payments. And yes, at the end, all these programs are recognized and accredited internationally and locally. And more details you can get if you fill this form. And if you make your decision in 3 days, you will get a very, very, very special price. How much buccal corridor space covered with the veneers? How do I know the price? Do you, doctor, you are amazing. Should I convince a patient with very mild imperfection to do veneers? Should I convince?
Okay, you should never convince a patient to do veneers. That's the ground rule, okay? Never convince a patient of something. The patient has to be convinced. You can, your work is to advise and to execute. Advise in what the patient wants, okay? So the patient, for example, is not happy with one thing that you think is minor. You think it's minor, but maybe for the patient, it's life-changing. Who knows, okay? So you have to get that information from the patient, and the patient tells you, this. And then you say, okay, if it's a minor change, we have alternatives. We can do composite. I can do maybe, you know, contouring, enamel contouring. I just take a small burr and then just, I take that away, and then I let it, you know, that's it. And then if you solve that problem, you don't have to convince to make a veneer. You solve the problem the way you think it's okay. Then you are a magician for the patient. Okay. And well, I lost the money of a veneer. Habibi, you gained a fan and you gained a voice that is going out and say, hey, this is a magician of aesthetic dentistry, and he will bring you a lot of patients. Don't worry about veneer, one veneer now.
So you have more things by online? Yes. Yes, we have online courses. We have Botox and fillers courses. We have very, very beautiful courses for Dr. Herman Gomez about dental business management, how to communicate with your patient, how to sell your treatment plan, how to make the marketing inside and outside the clinic. So just fill the form and we will call you back, or you can go directly to online.mastery-academy.com. Can you write it, Yasin, please? online.mastery-academy.com. Engineer Yasin. Thank you very much. The last question, please. I believe you. This is the last one. Some doctors now they do RCT, elective RCT for all teeth to avoid future sensitivity and problems. What do you think about that?
I think they might have their reasons. I'm not a fan of that. Let's say it this way, okay? I don't want to say it's good or bad or something else, okay? Not in this webinar. I prefer not to say.
Thank you very, very much. We got software free after we register in the modules. We will think about it. Okay, good idea. I will think about it, and I promise if I can, I will do. Thank you very much for joining, and thank you, Dr. Herman. Thank you for giving this time, and I know how your time is valued, and thank you for joining us tonight. Everybody, I am sure that you have enjoyed a lot. I hope to see you all in Khubar and Dubai, and see you in the next webinars and next courses. Thank you. Thank you very much.
Thank you so much. Thank